All right, Dr. Waguespack, please tell me, how did you end up at UT and what keeps you here? What do you like about this place?
So I actually went to medical school here, and then I left here for residency and fellowship and trained at Vanderbilt, and then always wanted to be in academics. There was a position open, so I decided to come back. I love Houston. I knew a lot about UT and McGovern Medical School, and there was a lot of opportunity, and so that's part of what brought me back.
That's great. And then tell me about your division. What kind of scholarly opportunities are there in nephrology? What are your clinical opportunities? What do you like about your division?
Yeah, so our division is we're a smaller group of faculty who are largely clinical. We have a lot of teaching roles from the medical student level all the way through the fellowship. We have opportunities to work with residents kind of on all of those levels, from didactics to our services that we attend on, from general medicine, where we have our own team that we're always in nephrology attending on, which is really, I think, unique experience and still glad that we do that as nephrologists. We have opportunities in outpatient clinics, both some of the things are that you guys do while you're on ambulatory rotation, some of the residents have joined us on their electives, and then opportunities on consult services at both our hospitals, which is great. So we get a lot of exposure to you guys, and you get to work with us. And then there's lots of opportunities from the quality improvement side, um, really to help do projects that are obtainable and completable while you're here.
Yeah, can you tell me about any of those quality improvement projects that come to mind? Because I know there have been some very interesting ones.
Yes, so we've done some of them we've done in the outpatient setting, where we've done education of our patients with vascular access, understanding dialysis, and things like that. We've done others that have to do with kind of dialysis discharge, and some of those are kind of ongoing, where we're trying to help with transitions of care from patients in the hospital and getting back to their dialysis units.
And then tell me about the fellowship program. What are the things that people like about the fellowship program and or your role in?
Yeah, so I've been the program director officially for about a year and a half. About a year into me joining UT, I kind of became really involved with the fellowship. We have 10 nephrology fellows total. They rotate at three different hospitals, and we've really kind of restructured and changed the program a lot to make sure we're focusing on education, and we've really grown in that regard. I think one of the great things is we have teams where we have fellows, particularly at the county hospital, who are working with the residents. But then there's other opportunities where it may just be our attending and our fellow on services, particularly in the ICUs and our heart and vascular institute, but we're still working very closely with the resident teams, because as a consultant in those ICU patients, there's a lot of communication and teaching in teams, and then there's opportunities for the residents to join us too on electives in that and in our transplant rotations and transplant services.
You mentioned the different institutions. Can you talk a little bit about the different patient populations and conditions that are treated at each of those institutions?
Yeah, so I think one of the benefits of one being in Houston and the Texas Medical Center, and the biggest medical center in the world, is definitely a draw, and one of the reasons I'm here, and one of the reasons we attract a lot of fellows to our fellowship program and residents. I think we also have the benefit of having three at least from our fellowship standpoint, and I know from the residency standpoint, three very different institutions where we see very different pathology in a city that's very diverse. So the county hospital, you see a lot of natural history of disease. You get to see and take care of patients who are underserved and we do a lot of, how to improve care there and a lot of really innovative things from, I know I've been involved in the residencies involved with kind of nutrition and a garden that's out at LBJ that I think is one of the coolest things that has recently kind of been implemented into kind of a holistic approach to patient care. Memorial Hermann being one of the biggest and busiest level one trauma centers here in Texas. We get to see all sorts of things from all over. Memorial Hermann is a large hospital system, so we get referrals in from outside in the community for second opinions, more specialized care. And so you see a large variety of patients in that regard. And then our fellows rotate at MD Anderson, where it's very specialized, oncology and onconephrology care there, and to kind of have exposure to kind of cutting edge treatment in cancer.
That's amazing. And so then just on a more personal note, what do you do for fun? What do you like about living in Houston? Do you have any interesting hobbies that you'd be willing to share with applicants?
So yeah, Houston's a great city. I think there's lots of great food. There's always new restaurants popping up. I think COVID has impacted that a little about going out to eat, but the great thing is most of those places you can order to go. I have two young kids, so we're pretty active kind of in the community. I think the other cool thing is that Houston has little niches of neighborhoods, so you can kind of find the fit that's best for you, your family, whether it's really close to the hospital or some people live a little bit further out. So there's definitely lots of a different opportunity there. So I danced growing up and swam growing up. So I got back into for wellness, and that's one big thing I know we've all focused on here is I take a dance class at night, so my residents on my current medicine team were asking more about that because one day I had a little bit of a knee injury, but that there's really a lot to do, and I think the other thing is I moved to Houston in high school, and so lived in the suburbs and in town too. There's a ton in the way of green belts and walkways and pathways and things to do outdoors that I think people don't always realize if you haven't been here or lived in Houston.
That's wonderful. Anything that I haven't asked you that you want to make sure to tell applicants or applicants interested in nephrology in particular?
Yeah, so I think you will find, and if you were actually here and we could meet you, you would see that the culture here is really supportive. I think we really love what we do. I love teaching. I love being in charge of the fellowship. I love working with residents. Dr. Swales is the same way. I think that we are really a big team here trying to make sure that you guys get the best experience and education. And I hope that you would, consider joining us and be a part of that.
Perfect. Thank you.